Today, we're hugely privileged to have Michael Gibney with us from the NHS Trust, the Walton Centre. He is the Director of Workforce and Innovation and is going to talk to us about some of the things he's seeing going on in the NHS today. Michael, thank you for being here today. You're the Director of Workforce and Innovation at the Walton Centre. Tell me a bit about that role.
So the Walton Centre is the only standalone neuroscience centre in the country. So it's quite small, so it's about 1,500 employees, but covers a really big footprint. So we're based up in Aintree in Liverpool, but we cover most of the North West, we cover the Isle of Man and North Wales. So my role is to look after HR, training, medical education, those kind of things that you would expect. The more interesting part of my job, and perhaps the more surprising bit, is the innovation side, and that includes medical innovation, so working with people to get the right medical kit in and boundary scans to see what's going on in the world. That also involves fundraising, so we're fundraising for really new and innovative bits of kit. And finally, it also includes research now, so that we're researching in the areas that we're trying to be innovative in.
Now, Michael, we talk about this quite a bit, but without a doubt, over the last 15 years, the NHS has seen significant improvements across it as an organisation. However, there are new challenges every day. How are the NHS combating them, and in particular using innovation to combat them?
It's mixed. Overall, the NHS is still doing brilliantly well. I think that's really important to stress. And you know, like in a trust like ours, demand can go up 7% annually. So often you're doing a lot more with the same resource. That there's two real big pressures. One is growing demand from the ageing population, but also conditions that used to see people die in effect. People now live through, so there's lots more demand coming at both ends, at the beginning of life and at the end of life. And also, we're virtually, for the first time ever, as an old HR professional, probably the first time ever, we're virtually in full employment conditions. So what that means is that if we can't carry on doing things in the way we are, because in the end we'll get stuck. So that's what's opened the door for innovation. Now, some of it is technological, so electronic patient records, sharing data, big data, looking at that allows you to look at the prevention agenda. So, you know, you understand alcoholism in certain areas of your patch, those kind of things. I think on its own, it doesn't solve it. Clearly, some of the other really big things are around the pace of technological innovation. And we need to be ready to embrace them and take them on. So in my trust, where we deal with a lot of complex rehab, that's where people are really smashed up, Charlie. So some people have been with us for 2 years. So, you know, someone's had a really bad horse riding or you know, motor accident. So in something like that, what you'll see on TV are things like exoskeletal robotics or, you know, kind of innovations like that. They mean nothing unless you've got the infrastructure to measure people's improvement, to measure improvements in gait and recovery, and to do research on it. And so that's part of the challenge. And I think the final thing I'd add around that is that we know we've not been good at this historically. Individual consultants have, collectively as a system we haven't. So we are trying to get more joined up as trusts and with local authorities.
So I think it's fascinating how you talk about cross-trust collaboration there and how important it is for the Walton Centre. Now, where do you see a tool like IdeaDrop being able to contribute to NHS Trust as we move into the next 5 years?
If we don't collaborate, we are not the sum of our parts, but quite equally, we don't know what to collaborate on, which is where an idea like IdeaDrop comes in. So in effect, we need to talk to people, specialists at the front line of the service. We need to kind of think through, we should have hundreds, thousands of ideas, and then be finessing them and deciding what are the key ones we want to take a punt on. But if we don't do that, we're always just knee-jerking, we're going problem, solution, problem, solution. So actually we need to get the ideas right and then look at how we can deliver around those. And I think part of the history of the NHS is it's been quite isolated. So one trust just looks, you look within your own trust. people are incredibly busy. So if you come to my trust, a lot of the consultants, a lot of the senior nurses are like hamsters on a wheel. They haven't got time to think. We need to create a space, and I would say certainly so far, Idea Drop's the best one I've seen. So, and we start to get those ideas out, start to finesse them, see who likes them, and then start to invest in those big ideas. Because the danger is we don't do anything. Well, I don't think that is a danger. The other end is we try to grow 1,000 flowers at once. We need 3, 4, 5 really big things that deliver for all the trusts.
I definitely think somewhere in all this a congratulations ordered, because as I understand it from my list here, the Walton Centre has achieved accolades in how you treat your people from awards such as the People Gold Standard Award, Investors in People and Health Wellbeing Awards, and apparently you're also currently within the HSJ Top 10 Places to Work. How are you achieving this, and how is innovation helping you access these type of awards?
We're very lucky in the fact that we've got a bridge through into an A&E, so it's a slightly calmer working environment. So that really helps, and I have to say that. But that said, we are very conscious that we have to engage the workforce, we have to be visible, and we have to get out there. I can't pay more than my competitors. I can't make the work easier. So therefore, what can I do? I can get down there and talk to people. We as an exec team can get down there, we can talk to people, we can find out what they'd like to do, what makes life better. And often there are very little things, from creature comforts to working practices to flexible working arrangements, all of those kind of things that culturally make a difference in the workplace and make people feel less anxious and happier.
I know that recognition is a massive tool in terms of engagement. How are you, if you are rewarding, and certainly how are you recognising the people that are really contributing to making a difference?
Quite a rigid pay structure and quite strong rules that both ourselves and trade union colleagues can follow. So recognition literally often is someone saying thank you. And often that's really down to middle managers saying, look, you came in, so theatre over around, you stayed here for that extra hour, that extra 2 hours, really appreciate it. We try to recognise it in monthly staff awards, in annual staff awards, in emails, in trying to recognise people at what they're doing. But I think formally, those things do matter, because sometimes people do extraordinary and exceptional stuff. We had someone who was in India recently during the floods and did a huge amount to save people's lives, literally, and that has to be recognised. And there are national awards in the NHS, but really, people, it's about what your line manager thinks. And if your line manager, you don't think they value you, you don't feel engaged. And that's the bit, really.
As a result of getting this culture correct and engaged, do you feel that contributions are a lot more prevalent in terms of continuous improvements, or culture innovation, your delivery?
We see it more in terms of people are willing to give their ideas. However, if we've not got a way of capturing this, and we've not got a way of finessing it, we really are going to struggle, because what you'll end up with is, I think it's a theme that I've returned to, but having too few ideas is a problem, but having too many is. You end up with lots of ideas, how do we bring them together?
Brilliant. Thank you so much for your time today, Michael.
You're very welcome.